Hello and welcome to Doylestown Health Cancer Institute. We are here to provide compassionate, personalized, and comprehensive care to patients when they receive a cancer diagnosis. We pride ourselves on being a community hospital and cancer institute that is small enough to provide tailored treatment and supportive care with the same resources as big city facilities. The following is all that's available to patients through our Cancer Institute so that they'll be well equipped for their journey. We are here for them every step of the way. We use a multidisciplinary approach to care, so our team is here to help patients from the beginning. These could include primary care physicians, oncologists, surgeons, radiologists, nurses, social workers, rehab therapists, nutritionists, and other allied health professionals. Here's some of what and whom patients might encounter in their journey. If a patient requires radiation treatment, our partnership with Penn Radiation Oncology at Doylestown Hospital provides a state-of-the-art facility and medical team located in the pavilion on our hospital's campus. It serves as Bucks County's satellite location for the most advanced radiation therapies available, including brachytherapy, image-guided radiation therapy, the breath hold technique, and intensity-modulated radiation therapy. Patients may also obtain special evaluations and direct referrals for proton therapy, gamma knife, or cyber knife at Penn Medicine. When it comes to oncology, our hematologists and oncologists through Alliance Cancer Specialists evaluate a wide range of treatment options, including chemotherapy, immunotherapy, hormone therapy, targeted molecular therapy, and vaccine therapy before recommending a plan of care for the best possible outcome. Should patients require infusion therapy, the outpatient infusion unit offers a spacious and comfortable environment for all of our patients with cancer or other illnesses to receive infusion medications. For patients, traversing the healthcare landscape after receiving a cancer diagnosis is far from easy. There are tests and treatments to schedule, physicians to speak to, visits to attend, and big decisions to make. The list of to-dos can seem endless, and the stress of the unknowns can be daunting. Our nurse navigators are a reliable resource and help guide patients through an extra challenging time. They are available for breast, lung, colorectal, and urologic cancers, and one is available for specific heart-related issues in our cardio-oncology program. Our navigators follow patients for the long run, not just while they're in the hospital like case managers. They provide extra support and spend a lot of time sharing their healthcare knowledge and educating patients on their conditions and treatments. Navigators tend to have a close working relationship with physicians too. Our navigators routinely meet with physicians, surgeons, oncologists, and the like to ensure they don't miss any aspect of a patient's care.
So patients are referred to me from the urology office since I focus on urological cancers. And once I get a referral, I'll call the patient and speak to the patient and family members and just let them know my role as nurse navigator for cancer services and let them know what else we have to offer in the cancer services department, whether they're genetics, counseling, research, and those kinds of options. And then I like to talk to the patient about how much they've understood about their cancer diagnosis, where they are, and just let them know I'm an unbiased resource for them to talk to about their concerns, questions, and just kind of be there and encourage them to call if they have any concerns, or if they're unsure, they should always just call. I would suggest to a patient who is working with a nurse navigator that they communicate as much as possible, especially in the beginning when they first get a cancer diagnosis. It can be overwhelming for the patient and also the family. If they're in communication with the nurse navigator, she can help to explain the diagnosis, what to expect during treatment, and just to help guide things along.
Because time is of the essence, we are proud to offer patients prompt service and limited wait times for appointments to develop a plan of care quickly and efficiently on cancer diagnosis. Patients will meet with our oncology nurse navigators before scheduled tests or biopsies. Our nurse navigators will be here to support patients during testing, provide thorough and coordinated services after tests are completed, and arrange for follow-up services and appointments if necessary. Our cancer specialists and pathologists use the most sophisticated technology available to accurately diagnose and stage cancer. We can also provide patients with second opinions or verification of cancer diagnoses. We have all the testing right here on our campus, as well as in satellite locations. We use the latest medical imaging technology for early screening, accurate diagnosis, and effective treatment planning. We are proud to offer the most advanced diagnostic imaging technology available at convenient testing locations. Our radiologists are fellowship trained and highly experienced in the latest imaging techniques, so patients can rest assured they are receiving the highest quality of care available. Depending on the cancer type, here is a list of some of the testing patients might undergo. As a comprehensive cancer center, we have all services from prevention and treatment to recovery and survivorship available to our patients. We encourage patients to undergo regular cancer screenings to build awareness and learn prevention strategies. Routine screening can detect cancer in its earliest stages, often before patients would experience symptoms or the disease advances. Our Cancer Institute uses the latest technology for cancer screening and diagnosis, including low-dose CT scans for up to 40% less radiation exposure. We provide patients with comprehensive educational information related to their diagnosis, and we'll schedule appointments with our experienced cancer specialists for follow-up tests. We offer a variety of screenings at the hospital and community-based locations. Cancer genetics is the study of hereditary and familial cancer. Sometimes there is a cancer in the family and individuals want to know more. Other times, patients might have received a diagnosis and want to get their family checked out. Our cancer risk and genetics services are specifically designed to help patients looking for information about their personal risk for cancer. Genetic counseling services are available through our Cancer Risk Evaluation Program. The primary goal of our program is to identify individuals and families at increased risk of cancer for the purpose of promoting awareness, early detection, and ultimately cancer prevention. Our genetic counselor provides our patients with a better understanding of their personalized lifetime risk for cancer, helps to provide a potential hereditary cause for a current or previous diagnosis, helps identify what other organ systems may be at risk for developing cancer, personalizes screening recommendations, and helps direct their future medical management. Importantly, genetic counseling and testing can help identify what other family members could be at high risk of developing cancer. The genetic counseling process involves the review of both patient medical history and family history. The patient receives a thorough education on genetics, different hereditary syndromes, possible risks, genetic testing options, and how genetic results would affect treatment and future care. Our counselor is always available to answer questions, consult with members of our multidisciplinary team, as well as discuss directly with patients to see if genetic counseling and testing is appropriate for them. Our Cancer Institute offers patients the most advanced cancer treatment options available in the Philadelphia region. Our cancer team works closely with patients, prescribing the best course of treatment after carefully considering your specific diagnosis, stage of disease, treatment goals, and overall health, lifestyle, and personal preferences. We encourage patients to discuss treatment options with our board-certified oncologists and cancer specialists. We offer the latest chemotherapy and infusion therapies, advanced radiation therapies, surgical treatment options, complementary therapies, and specialized programs for managing cancer treatment side effects such as lymphedema and cardio-oncology, which focuses on cancer therapy effects and your heart. We also have our own pharmacy on site to help with conveniently providing patients with the medications they need when they need them. At Doylestown Hospital, patients can expect a collaborative effort of the oncology team. Doylestown Health's Cancer Committee is a multidisciplinary team of specialists responsible for setting goals, planning, initiating, implementing, evaluating, and improving all cancer-related activities at the hospital for the highest quality of care. The Cancer Committee evaluates the outcomes of patients treated at Doylestown Health to measure quality and enhance patient care. National Cancer Database serves as the Cancer Committee's benchmark to evaluate trends unique to the Doylestown region and make ongoing improvements. Cancer conferences and tumor boards meet 4 times per month in a multidisciplinary forum with representatives from medical oncology, radiation oncology, surgery, radiology, and pathology. At these information sharing meetings, medical staff and cancer specialists review newly diagnosed cancer cases and collaborate on personalized treatment recommendations to ensure the best possible outcome for each patient. These forums also review National Comprehensive Cancer Network guidelines, prognostic indicators, and site-specific factors, and discuss rare tumor types for educational purposes and multidisciplinary input. We are committed to continuing medical and professional education. Doylestown Health physicians, nurses, and allied health professionals attend educational programs regularly. Our staff is devoted to being at the forefront of best practices, new technology, and advancements in treating cancer. At our Cancer Institute, we conduct research and clinical trials. Our cancer care team is proud to offer patients the latest opportunities and the convenience of participating in these vitally important cancer research programs. We are a member of the Eastern Cooperative Oncology Group, one of the largest clinical cancer research organizations in the United States, conducting clinical trials in all types of adult cancers. ECOG is funded by the National Cancer Institute, part of the National Institutes of Health. Our goal is to care for patients from the time of initial diagnosis, during treatment, and throughout recovery and survivorship. We have a variety of programs to support patients here, and we have connections to programs that patients can benefit from in the community.
At Doylestown, we are truly a team that rallies behind our patients. Patients feel they're getting the personalized care from an employee who may also be their neighbor. Our patients feel supported by people who will go the extra mile for them. As a social worker, I work closely with the physicians, nursing staff, navigators, and all the other multidisciplinary team members. I'll be that connection for our patients with services outside of our walls. Patients can come to me to find those services that will support their cancer journey. Patients not only have access to the full menu of cancer care, including medical oncology, radiation oncology, and surgery, but also to our psychosocial support from licensed social workers. Our social work team can provide short-term individual counseling, in-person and virtual support groups, and referrals to other emotional support providers in the area. For our breast cancer patients, we can link them with a Doylestown Health breast cancer survivor who's been through a similar diagnosis and treatment plan. This person can serve as a mentor and become part of our patient support team. We also help to coordinate cancer screening opportunities for our uninsured residents and talks about preventing cancer for our local community. Many patients utilize our integrative services as well. We're able to refer our patients to nutrition education, rehabilitation services, massage therapy, a medical fitness program, palliative and hospice care, as well as referrals to local community organizations that support our patients. We're also very aware of the financial burden that paying for medical care can weigh on our patients. Our social workers are experts at trying to find options to pay for care, whether it is help in applying for Medicaid, patient assistance programs, charity care, or finding grants to pay for living expenses. We also can help patients afford wigs, lymphedema supplies, and prosthetics. Whatever the need, our social workers work to ensure that any financial barriers are removed for our patients.
Our support groups provide patients with opportunities to participate according to their own preference or personal needs. We offer a wide range of services, educational resources, and social activities, including Doylestown Health Cancer Support Groups. Our cancer support groups meet at Doylestown Hospital, at the Health and Wellness Center in Warrington, Pennsylvania, or online. Individuals who are diagnosed with or affected by cancer are welcome to attend. Groups cover various topics including living with cancer, life after cancer treatment, managing treatment side effects, and bereavement support. Cancer Support Community Greater Philadelphia at Doylestown Hospital is a free membership program for anyone affected by cancer. The club is part of the Delaware Valley chapter and provides support groups, networking, educational and social activities, seminars, post-treatment survivor services, and much more. Local residents living with cancer and their families can find strength and support at CSC Doylestown. The Doylestown Hospital location features a kitchen area, art studio, resource library, and space for yoga, meditation, and Pilates classes. It is located on the main floor of Doylestown Hospital. In addition to speakers and educational workshops, the focus is on healing and creative arts and the mind-body connection. All of the Cancer Support Community workshops and programs are free and available to men, women, and children. The Cancer Support Community office is located in the hospital near the main lobby. Look for the club signature red door. Ribbon Studio, a retail store based at Doylestown Hospital, offers patients and caregivers the convenience of shopping for products needed during cancer treatment or as a cancer survivor. Ribbon Studio carries a variety of wigs, head wraps, hats, and scarves. A common side effect of surgery or radiation treatment is lymphedema. This condition occurs when lymph fluid in the fatty tissues just under the skin builds up and causes swelling, usually in the arms or legs. We offer patients with cancer a comprehensive lymphedema management program through our rehabilitation therapy department to ease and control symptoms. Our palliative care team is committed to helping patients and their families when they have a serious illness like cancer. Because traditional medical providers often don't have the time to sit with the patient and talk about their health goals, palliative care can help close the gaps. Our team works along with a primary care physician and other specialists to provide a person and family-centered approach that attends to patients' physical, functional, social, and psychological needs. As a result, our palliative care team provides an additional layer of healthcare support for patients and their families. We recognize that when patients are cancer survivors and as they move beyond treatment, their healthcare needs evolve. As part of our continuum of care, upon completion of treatment, survivors receive survivorship care. This is an important component of quality cancer treatment as it identifies important milestones for follow-up and provides patients with resources and information to keep them well. Survivorship care plans can or may include treatment summaries, potential long-term treatment side effects, post-treatment recommendations, follow-up care referrals, health tips, community and educational resources. Benefits of survivorship care plans may include ongoing planning and coordination to assist you with maintaining your physical and emotional health post-treatment, discussing post-treatment needs with a health professional, improving quality of care, monitoring and maintaining health, individualizing survivorship care. We are privileged to serve our patients and families throughout their cancer journey, and we take our role in their treatment and recovery very seriously. We are here for them every step of the way.